Imagine this. It's a normal evening. You're sitting comfortably on your couch watching TV after a long day. Everything feels peaceful. Nothing seems out of the ordinary. Then suddenly, something feels different. Not intense pain, not an emergency that immediately grabs your attention, just a strange pressure deep inside your chest. You place your hand over your chest. Maybe it's nothing. Maybe it's just heartburn. Maybe you ate too much dinner. That's what thousands of people tell themselves every single day. And sadly, many of them wait far too long before asking for help. Here's the frightening truth. Most heart attacks don't begin like they do in Hollywood movies. There isn't always a dramatic collapse. There isn't always unbearable pain. Sometimes your heart whispers before it screams. If you don't recognize those whispers, valuable time can be lost. You look into the mirror and tell yourself, "I'll be fine. I just need a little rest. I'll wait another 10 minutes." But your heart doesn't know you're waiting. Every passing minute allows more heart muscle to struggle without the oxygen it desperately needs. Time. During a heart attack, time is one thing you can never get back. Every second matters. Every minute can make a difference in how much of your heart can be protected once medical treatment begins. Inside your body, one of the arteries supplying your heart may be blocked. Without enough oxygen, the heart muscle begins to suffer. The longer the blockage continues, the greater the damage can become. That's why doctors often repeat one simple phrase: time is muscle. We've all seen the movie version. Someone suddenly grabs their chest, falls to the floor, and everyone instantly knows it's a heart attack. Real life is often very different. Many people stay awake. They can still walk, still talk, and because they can, they mistakenly believe nothing serious is happening. For some people, especially women, the warning signs can be even harder to recognize. Instead of severe chest pain, they may notice unusual tiredness, pain in the jaw, discomfort in the shoulders, or simply feeling short of breath. These quieter symptoms are easy to ignore, but they shouldn't be.
Pain doesn't always stay in the chest. It can travel into the left arm, both shoulders, the neck, the jaw, the upper back, or even the upper stomach. That's why every unusual symptom deserves attention. Even climbing a few steps or simply sitting still may suddenly leave someone struggling to catch their breath. When breathing becomes difficult together with chest discomfort, it's important not to ignore it. Cold sweats, dizziness, nausea, these symptoms often appear without warning. Many people mistake them for stress or exhaustion, but sometimes they're your body's way of asking for urgent help. Have you ever felt completely exhausted for no obvious reason? Some people describe it as feeling like every bit of energy suddenly disappeared. That unexplained fatigue can sometimes be an early warning sign. One of the biggest mistakes people make is assuming it's only indigestion or heartburn. They take medicine, drink water, lie down, and hope the discomfort disappears. Sometimes it doesn't. While you're waiting, your heart keeps fighting. Without enough oxygen-rich blood, heart muscle begins to suffer. The sooner treatment begins, the better the chance of limiting permanent damage.
Remember these 3 words. Time is muscle. The faster someone recognizes the warning signs and seeks emergency medical care, the greater the chance of protecting the heart. Heart attacks don't always look the same. Women may experience different warning signs than men. That's why unusual fatigue, jaw pain, back pain, nausea, or shortness of breath should never be ignored. People living with diabetes may also notice fewer warning signs because nerve damage can change the way pain is felt. Even mild symptoms deserve careful attention. The biggest danger isn't always the heart attack itself. Sometimes it's the decision to wait. 5 minutes become 30. 30 minutes become an hour, and precious heart muscle is lost. Recognizing the warning signs early gives doctors the best opportunity to help.
Acting quickly can make a real difference. Emergency teams are trained to begin care as quickly as possible. Those first moments are incredibly important. So here's the question. If a heart attack can begin so quietly, would you recognize it before it's too late? In the next chapter, we'll reveal the 3 most important actions to take during those critical first minutes and why they can make all the difference.
What if I told you the next 10 minutes could determine how much of your heart survives? During a heart attack, the clock isn't just ticking, it's deciding the future of your heart. Every second feels invisible, but inside your body, a race against time has already begun. Unfortunately, your heart can't afford to wait. Your heart is one of the hardest working muscles in your body. Every single day, it pumps thousands of liters of blood without taking a single break. But even this incredible organ depends on one thing: a constant supply of oxygen-rich blood. Normally, blood flows smoothly through the coronary arteries. These arteries deliver oxygen and nutrients that keep every heartbeat strong. As long as blood flows freely, your heart keeps working normally. Over many years, fat, cholesterol, and other substances can slowly build up inside these arteries. Most people never notice it's happening. There are usually no warning signs. Then, one day, without warning, that plaque can suddenly rupture. Your body immediately tries to repair the damage, but sometimes that repair process creates a dangerous blood clot. The clot grows rapidly. What started as a small blockage becomes larger and larger. Soon, blood can barely pass through the artery. Then it happens. The artery becomes completely blocked. The section of your heart beyond that blockage suddenly loses its oxygen supply. A heart attack has begun. Without oxygen, heart muscle begins to suffer almost immediately. Minute after minute, more cells become damaged. The longer blood flow is blocked, the greater the injury. Unlike your skin or your muscles, heart muscle cannot easily replace dead cells. Once those cells are gone, they are gone.
That's why heart specialists repeat one important phrase: time is muscle. The faster treatment begins, the more heart muscle doctors may be able to preserve. Sadly, many people don't recognize what's happening. They decide to wait. They hope the discomfort disappears on its own. But the heart keeps losing precious time. They tell themselves, just 15 more minutes. But 15 minutes can make a huge difference during a heart attack. Waiting may allow even more damage to occur. While you're waiting, the blood clot may continue growing. Less blood reaches the heart, less oxygen reaches the muscle, and the damage can become more severe. At the same time, your heart is still trying to pump blood throughout your body. It has to work harder, even though it's receiving less oxygen than it desperately needs. Some people continue walking, climbing stairs, or carrying heavy objects. Without realizing it, they're forcing their injured heart to work even harder. Others try to drive themselves to the hospital. That can be dangerous. If symptoms suddenly become worse while driving, it could put both the driver and others on the road at risk. Stress and panic can also make the heart beat faster. A faster heartbeat requires more oxygen, but because the artery is blocked, that oxygen simply can't get through. This is exactly why emergency medical teams encourage people to call for help immediately. Every minute saved before treatment begins may help protect more of the heart. Long before you reach the hospital, doctors and nurses are already preparing. The sooner they know you're coming, the sooner they can begin life-saving treatment. Every heartbeat tells a story. Doctors use heart monitors and other tests to quickly understand what's happening, so they can act without unnecessary delay. When blood flow is restored quickly, more heart muscle can survive. That often means a stronger recovery and a better chance of returning to normal life. Remember, those first 10 minutes aren't just numbers on a clock. They may be the most important minutes of the entire emergency. So, if you ever suspect a heart attack, what should you do first? Should you wait? Should you drive yourself? Or is there a better way? In the next chapter, you'll discover the 3 most important actions recommended when someone may be having a heart attack and why doing them in the right order can make all the difference.
What would you do if a heart attack started right now? Would you recognize the warning signs, or would you lose precious minutes wondering if it was something less serious? Those next few moments could make all the difference. The pain may feel like heavy pressure, tightness, or a squeezing sensation in the center of the chest. Don't ignore symptoms that last for several minutes or keep returning. The first and most important step: call your local emergency medical services immediately. Don't wait to see if the pain goes away. Getting professional help started as soon as possible is critical. Stay calm and answer the dispatcher's questions clearly. Describe your symptoms, your location, and follow every instruction they give you while help is on the way. The moment your call is received, a trained emergency team begins moving towards you. Every minute saved can help speed up diagnosis and treatment. Inside that ambulance are professionals trained to respond to cardiac emergencies. Their goal is to reach you quickly and begin care as soon as possible. When paramedics arrive, tell them exactly how you feel. Mention when the symptoms started and any medical conditions or medications you have if you can. One of the first things they may do is check your heart rhythm with an ECG. This helps them understand what's happening and communicate important information to the hospital. Even before you arrive, the hospital may already be preparing its cardiac team. That early preparation can reduce delays once you reach the emergency department. Some people may be advised to chew aspirin, but aspirin is not right for everyone. Only take it if emergency medical personnel or your healthcare provider advises it, and if you don't have a reason to avoid it, such as an allergy or certain bleeding conditions.
Aspirin may help reduce the tendency of platelets to stick together. But remember, it is not a cure for a heart attack. Professional medical treatment is still essential. Now, stop all physical activity. Sit down in a comfortable position. Avoid walking around or trying to push through the pain. Take slow, deep breaths. Staying as calm as possible can help reduce additional stress while you wait for emergency responders. If you're alone and it's safe to do so, unlock your front door. This simple action can help emergency responders reach you more quickly if your condition worsens. Stay seated near the entrance if possible. Keep your phone nearby. Avoid unnecessary movement while waiting for help. Don't try to drive yourself if you're experiencing severe symptoms. Your condition could suddenly become worse, putting both you and others at risk. If a loved one is with you, ask them to stay calm, call emergency services, and remain with you until help arrives. Working together can make the situation easier to manage. Emergency responders can begin assessing and treating you on the way to the hospital. They'll continue monitoring your heart and provide care based on your condition. When you reach the hospital, doctors and nurses are ready to move quickly. Rapid evaluation helps determine the best treatment for your situation. Let's remember the 3 most important actions. First, call emergency medical services immediately. Second, follow the guidance of trained medical professionals, including whether aspirin is appropriate for you. Third, stop physical activity, rest, and stay as calm as possible while waiting for help. Quick medical treatment can help restore blood flow and limit damage to the heart. That's why acting without unnecessary delay is so important. Many people recover well after a heart attack with timely medical care, rehabilitation, and healthy lifestyle changes. Early action gives you the best chance to begin that recovery. Your heart works every second of your life. Protecting it starts with recognizing the warning signs and responding quickly when something feels wrong. Always remember this simple phrase: every minute matters. Don't ignore symptoms. Don't wait. Get professional help as soon as possible. Now you know the 3 most important actions to take during those first critical minutes. In the next chapter, we'll uncover the biggest mistakes people make during a heart attack and how avoiding them could save valuable time.
You've learned the 3 most important actions to take during a heart attack, but there's something just as important: knowing what not to do. Every year, thousands of people lose valuable time, not because help isn't available, but because they make one critical mistake before calling for it. Let's look at the most dangerous mistakes people make during those first life-changing minutes. The biggest mistake is simply waiting. Many people think, "It will pass. I'll feel better in a few minutes. I don't want to overreact." But a heart attack doesn't stop while you're deciding what to do. Every minute without treatment may increase the amount of heart muscle affected. Another common mistake is assuming it's only heartburn or indigestion. Yes, heartburn and heart attack symptoms can sometimes feel similar, but if chest discomfort is new, severe, or accompanied by symptoms like shortness of breath, sweating, nausea, or pain spreading to the arm, neck, or jaw, it should never be ignored. It's always safer to seek emergency medical evaluation than to guess. Many heart attacks begin quietly, not with unbearable pain, but with pressure, tightness, or discomfort that's easy to dismiss. Some people continue working, answering emails, or finishing meetings without realizing their heart is asking for help. Even mild pressure in the center of your chest deserves attention, especially if it lasts several minutes or comes back again. Listen to your body. Ignoring early warning signs can delay treatment. Another dangerous decision is driving yourself to the hospital. If your condition suddenly worsens behind the wheel, you could lose control of the vehicle and put yourself and others at risk. Whenever possible, call emergency medical services instead.
Remember, time isn't just passing. Your heart is depending on every minute. That's why doctors often say, time is muscle. Without enough oxygen-rich blood, heart muscle can become damaged. The sooner blood flow is restored by medical treatment, the better the chance of limiting that damage. One phone call can start the entire emergency response. Emergency dispatchers, paramedics, hospital doctors, and cardiac specialists all become part of your care. Never hesitate to make that call if symptoms strongly suggest a heart attack. When the ambulance arrives, professional care begins immediately. Your heart rhythm can be monitored, your condition assessed, and the hospital can prepare for your arrival. Inside the emergency department, every second counts. Doctors work quickly to identify the cause of your symptoms and begin the most appropriate treatment. Acting quickly doesn't just help your heart. It may give you more moments with the people who love you most. Sometimes, the best gift you can give your family is making the decision to seek help without delay. With timely treatment and proper follow-up care, many people recover and return to active, meaningful lives. Recovery often includes medication, rehabilitation, and healthy lifestyle changes recommended by healthcare professionals. Never forget this simple message. Every minute matters. Recognize the warning signs. Respond quickly. Let trained medical professionals take over. The decision you make today could mean being there for future birthdays, family vacations, graduations, and all the moments that matter most. Your heart works for you every second of your life. When it sends a warning, don't ignore it. Recognize the signs. Act quickly. Seek emergency medical care immediately. Because when it comes to a heart attack, every minute truly counts.